Welcome to this video presentation for HPRS, Medicare-eligible retirees. HPRS has chosen VIA Benefits, a part of Willis Towers Watson, to help you with your health insurance. As you view this presentation, I hope that you find what I share to be informative and helpful as you consider the changes that you'll be making this year to your health care coverage. Today, I'll be talking about who we at VIA Benefits are. My goal is for you to leave this meeting feeling comfortable about working with us. I want to make sure that you understand what changes are being made to your health care coverage and what action steps you need to take this year to enroll in new medical coverage. We'll get into some of the information about your plan options and explain the tools that you'll use to help select a new plan. I'll also talk about the funding that HPRS is providing for you in the form of a health reimbursement account. By the end of this presentation, I hope that you'll feel comfortable with the process and understand what action you need to take in the coming months. Let's start by introducing who we are. VIA Benefits is an insurance marketplace. Hundreds of employers of all sizes, both public and private, including many of the largest companies in the world, have trusted VIA Benefits to help their retirees when it comes to Medicare. VIA Benefits is the first and largest private company to offer this service. Over the last 16 years, VIA Benefits has helped over 2 million people transition to individual Medicare health insurance. And we've completed these transitions with continuously high customer satisfaction. We're not an insurance company. Our insurance marketplace offers plans from over 120 national and regional insurance companies, which gives you a wide variety of choices, so you can find a plan that meets your individual healthcare needs and budget. VIA Benefits is available to you online 24 hours a day, 7 days a week, or on the phone Monday through Friday from 8 o'clock in the morning until 9 o'clock in the evening Eastern Time, and on Saturdays between October 9th and November 20th from 9 a.m. to 7 p.m. Eastern Time. All of our staff is based within the United States. Outside of our business hours, you can go on our website. We have an online help and support center with articles on how to use our tools and services, as well as information about Medicare. If you call during our business hours, you'll be speaking with our team of benefit advisors. They're trained to help you choose and enroll in health insurance and to act as your health insurance advocates going forward. Calls to our service centers are toll-free, and there are no fees for the consultation and services provided to you. Through VIA Benefits, you'll have access to all types of individual Medicare plans. Let's spend the next few minutes talking about some of your options. You can select Medicare Supplement, also known as Medigap plans, Medicare Advantage plans, sometimes known as Medicare Part C, prescription drug plans, and hospital indemnity plans. I'll go into further details about each of these plan types in a moment. In order to find insurance coverage that fits your individual needs, it's important that you have different plans to consider. We work with over 120 national and regional insurance companies. Some of their logos are on the screen now. Whether you recognize the insurance companies shown here or not, VIA Benefits is diligent in only allowing plans on our platform that meet high industry standards. Medicare insurance coverage begins with a foundation of Medicare Parts A and B, also called Original Medicare. You should all have this already. If you don't, contact Social Security now to see if you can start the process to get it. You must have both Medicare Parts A and B, in order to enroll in additional healthcare coverage, and we think you'll want it. While Original Medicare covers a lot of things, it doesn't cover everything, and your cost sharing will be higher if this is the only coverage that you have. Because of this, Medicare allows you to enroll in additional coverage that gives you enhanced medical protection and lowers your cost sharing. Your new coverage will be in one of two forms: either a Medigap plan option, to which you can add a separate Part D prescription drug plan, or a Medicare Advantage plan, which typically bundles in prescription drug coverage. Individual Medicare plans are not family or group plans, which means each individual will select the plan or plans that fit their personal health insurance needs. In addition to these Medicare plans, our benefit advisors will provide information and enrollment support for additional protection plans, like hospital indemnity plans. HPRS will continue to offer dental and vision insurance plans, so there will be no need to sign up through Via Benefits for those. Now, let's talk about these two main plan options in more detail, starting with the Medicare Advantage plans. Medicare Advantage plans provide all-in-one plan coverage, which bundle hospital, medical, and, most of the time, prescription drug benefits too. They also can provide other benefits that aren't covered by Original Medicare, like dental or vision coverage, and gym memberships, like Silver Sneakers. The monthly premiums you pay for a Medicare Advantage plan can be quite low, even $0. This type of plan does include out-of-pocket costs, such as co-pays, co-insurance, and possibly deductibles. Medicare Advantage plans are network-based plans. This means that they each have a network of doctors and facilities that will accept the plan. The two main types of Medicare Advantage networks are the HMO and PPO types. HMO stands for Health Maintenance Organization. PPO stands for Preferred Provider Organization. The biggest difference between the two is that an HMO has a narrower network, and your coverage comes from doctors who are in that network. If you need to see a specialist, you probably will need a referral from your primary care physician, and the specialist will also be in the network. If you go to a doctor outside of the network, your HMO plan will not cover the visit. PPO plans also have networks, but they will allow you to get care from a healthcare provider who is outside of the network. Medicare Advantage plans are always guaranteed issue, which means that they won't ask about your pre-existing medical conditions, and you cannot be denied coverage. For those of you that select a Medicare Advantage plan, you may want to consider a hospital indemnity plan. This is a popular plan choice for participants that enroll in a Medicare Advantage plan because it provides additional protection from out-of-pocket costs for hospital visits. Bundling these two plans together allows you to take advantage of low monthly premiums and still provides protection against potential high medical out-of-pocket costs associated with hospital visits. The other option is to enroll in a Medicare Supplement Insurance Policy, or Medigap plan. Medigap plans don't bundle coverage, so you'll need a separate prescription plan to cover your drugs. Standard Medigap plans have no networks, which means that you can see any doctor or go to any facility in the United States that accepts patients with Original Medicare. This may be important if you're a snowbird and reside in multiple locations. There are a few Medigap plans that are labeled Select plans that do have a defined network. The premiums for Medigap plans are usually higher than Medicare Advantage plans. This is because they build in some of the copay, coinsurance, and deductible costs into the plan. With a Medigap plan, you pay more upfront in premiums and less when you go to the doctor. Medigap premium rates are not regulated through the Centers for Medicare and Medicaid Services like Medicare Advantage plans, which means rates can increase at any time during the year. With some insurance companies, your rate may increase after you complete your enrollment, but before the policy is issued. Typically, it's a small amount, usually a couple of dollars or less per month. But keep that in mind if you're considering a Medigap plan. One last thing to know about Medigap plans: they will require the first month's premium at the time of enrollment. This means that you'll pay your January monthly premium when you complete your application, but then you won't make your next premium payment until February. We've talked about additional protection plans that will be available for you to consider. For many who choose a Medigap supplement plan, a popular plan to add is a combined dental, vision, and hearing plan, or DVH plan. These plans bundle all three benefits into one plan with one monthly premium. Again, since HPRS is continuing to provide dental and vision coverage, you won't need to get that coverage through VIA benefits. Medigap plans have simple single-letter names in most states, like Medigap Plan K or Medigap Plan D. There are up to 10 different standardized Medigap plans to choose from that offer varying levels of coverage. For example, a Medigap Plan G is considered an exceptionally comprehensive plan. After you pay the monthly premium and the Part B deductible, the Plan G will pay for 100% of the remainder of your Medicare-eligible medical costs for the rest of the year. Due to recent Medicare changes, two of the options, Plans C and F, will no longer be offered to those who first became Medicare eligible in the year 2020 or later. Medigap plans will be offered through different insurance companies, but the plan will work the same regardless of which company you select. That is, a Plan N from one insurance company will cover Medicare the same way as a Plan N from another insurance company. The difference in Medigap plans from one insurance company to another is the cost of the premium, as they each set their own premium price for their Medigap plans. So a bargain price does not mean less coverage. Let's take a few moments to discuss Medicare prescription drug plans. All Medicare prescription drug plans, whether they are standalone Part D plans or bundled into Medicare Advantage plans, have the same basic structure, but they can vary widely in which drugs they cover and what they charge for those drugs. That makes choosing a prescription drug plan a very personal choice, because most people take a different set of drugs than someone else. Our online tools take the guesswork out of this for you and will provide you with a recommendation based on the individual drugs that you take. The website and our benefit advisors will always provide a recommendation based on the lowest out-of-pocket cost for you. Prescription drug plans start with a formulary. Formulary is the name for the list of drugs that a plan will cover. Each plan can have a different formulary list, and each plan will divide that list of drugs into separate tiers. The cost that you pay will be determined by the insurance company and the tier level that they've assigned for your prescriptions. We usually see 5 tiers in a plan's prescription drug formulary. Tier 1 drugs will be the less expensive preferred generic drugs. Tier 2 is usually called non-preferred generic. Tier 3 is for preferred brand name drugs, and Tier 4 is for non-preferred brand name drugs. The prices usually increase as the tier levels increase. Tier 5 is called specialty drugs, for drugs that are very expensive. There are some medications that Medicare will not cover, such as medications for weight loss or weight gain. Some medications may be covered under your Part B medical plan instead of your Part D drug plan. Those medications are typically drugs administered by your doctor in the doctor's office, such as some chemotherapy drugs. Part D drug plans may or may not have a deductible. If they do, you'll be required to pay the deductible in full before your prescription drug benefits kick in. The maximum amount a deductible can be is $480 per year for 2022. If your plan has a deductible, it may mean that you'll pay more for your prescriptions until that deductible has been paid off. Once the deductible has been met, your prescription drug benefits will begin, and you'll pay a copay or percentage depending on the tier level of your medications. All drug plans, whether they are built into a Medicare Advantage plan or a separate Part D plan, will include a coverage gap. You will hit the coverage gap if the cost of your drugs, what you pay and what the plan pays, reaches $4,430. Don't let these numbers scare you. Your plan will pay a large portion of these costs. If you only take generic medications, or even a few brand name drugs, you most likely will never reach the coverage gap. You'll be able to see if you reach the coverage gap when you're looking at plans online or talking to a benefit advisor about a plan. If you reach the coverage gap, you'll pay 25% of the cost of your medication. The drug manufacturer will pay 70% of the cost of the medication. If the amount that you pay and the 70% that the drug manufacturer pays reaches $7,050, then you'll enter the next phase called catastrophic coverage. Again, keep in mind that you only pay 25% of the cost of the medication while you're in the coverage gap. The drug manufacturer pays the majority of the cost. Not many people will reach the catastrophic coverage phase, but if you do, the cost of your medications will decrease considerably, and you'll pay $3.95 for generics, $9.85 for brand name drugs, or 5%, whichever is greater. HPRS will provide additional funding for those that reach the catastrophic prescription drug phase, which we'll talk about more on the next slide. If you reach the catastrophic coverage phase, you'll be eligible for a secondary funding account used to reimburse your prescription drug expenses. You'll need to meet the eligibility requirements for this benefit, which consist of submitting your explanation of benefits to show that you've reached the catastrophic prescription drug phase. Once you provide the appropriate documentation, a second funding account will be established in your name. You will use this account to reimburse your prescription drug out-of-pocket expenses for the remainder of the year. In late December, you'll receive a VIA Benefits Guide to Reimbursement. This guide will include information about this benefit so that you know how to access it if you ever reach the catastrophic coverage phase. Once you've selected a plan, the next step will be to enroll. Let's walk you through how that's done. But first, let me show you a short video so that you can meet some of the people who may be helping you enroll in your new healthcare coverage.
Good afternoon, and thank you for calling.
Hello, my name is Sanique. I'm a licensed benefit advisor with VIA
Benefits Insurance Services.
I have assisted my parents with this, and I know this can be a kind of a challenging type situation.
Mr. Jones, I just want to reassure you, I am Medicare eligible. I know exactly what you're going through.
If you're more computer savvy, try the website first. If you'd rather talk to someone on the line directly so you can get your questions asked at that moment, then pick up the line and call.
If we suspect that they're not ready to make a decision, we don't push them. We'll simply say, we're here to help you. We're here to advocate for you on your behalf. In the meantime, if you have questions, don't hesitate to give us a call. We're here to answer those questions to help you get through this process.
VIA Benefits helps you enroll in healthcare coverage through an efficient and proven three-step process. Step 1. Prepare. You can start preparing for your enrollment call now by going online or calling VIA Benefits to complete your profile and add all of your doctor, pharmacy, and prescription drug information to your account. Step 2. Review. You can start looking at your options by becoming familiar with our Shop and Compare and other decision support tools online, or by calling VIA Benefits and speaking with a benefit advisor. Step 3 is enroll. Completing these steps will ensure that you're ready to enroll during your enrollment window. Included in your announcement package from HPRS was a booklet called the Getting Started Guide. This booklet will help you get started for your upcoming enrollment by providing you with the information that you'll need to prepare for the enrollment process. You have the option to have a pre-enrollment call with a benefit advisor. If you prefer to do everything online, this call is not required, but it is highly recommended. If you plan on enrolling over the phone with a benefit advisor, you'll need to complete your pre-enrollment call. During this call, you'll complete your profile, which includes adding your doctor's, pharmacy, and prescription drug medications to your profile. The benefit advisor will talk to you about your basic medical needs and budget, and will help you decide if a Medicare Advantage plan or a Medigap supplement plan is right for you. They will note your account with the type of plan they recommend for you. The benefit advisor will then offer you two options to enroll: online or with a benefit advisor. If you choose to enroll over the phone with a benefit advisor, they will schedule an enrollment appointment for you during your enrollment window to complete your applications. Because we don't know if you wish to do everything online or over the phone, VIA Benefits will be calling you. If you wish to do everything online, you simply need to tell the benefit advisor of your preference when they call, so that they don't continue trying to contact you. Or you can call them and let them know of your preference. If you're enrolling over the phone with a benefit advisor, you should have an enrollment appointment already scheduled during your enrollment window. You will need to call into VIA Benefits at your appointment time. VIA Benefits will not be calling you for your enrollment appointment, so be sure to write that down so you don't forget. We wouldn't want you waiting around for a phone call. The VIA Benefits Enrollment Guide contains a reminder about your enrollment period, information about your funding account, and outlines the steps that you must take to complete your enrollment. It will also contain the phone number to call and the web address. That number is 1-833-431-1358. And the website is at my.viabenefits.com/HPRS. This guide does not contain detailed plan options and information. You can view that information online by visiting our website at my.viabenefits.com/HPRS, starting October 1st. If you go online, Shop and Compare is an easy tool that allows you to view and compare Medicare-related insurance plans available in your area and sort them by price, plan type, insurance company, and other factors. With just a few clicks, you can compare plans side by side and review the details of plans that interest you. Earlier, we mentioned how Medicare Advantage plans can cover some things that Medicare doesn't. These are known as optional supplemental benefits. If you're shopping for Medicare Advantage plans, the results will clearly display when a plan offers optional supplemental benefits, like meal plans, gym memberships, and hearing aids. You can click on the link to see more details about the benefits offered. Another tool on the website is the Help Me Choose tool. This tool will ask you questions about your needs and recommends the types of plans that might fit those needs. You can then compare actual plan details on the website. If you entered your physicians in the My Doctors section and the prescription drugs that you're currently taking, you will be able to see the plans which your doctors accept and the Part D plans which cover your prescription drugs. One of the best things about the website is that it operates 24/7 for your convenience. When you search for plans, if you haven't entered your current prescriptions or your prescriptions have changed, you're able to enter or update the prescriptions in your personal profile, which will then compare the coverage of those drugs between the plans that are available to you. Before your preferred enrollment window begins, you should have completed all of the steps that we've talked about today and have a good understanding of which type of plan you'd like to enroll in. This will help save time during your enrollment call and make the process easier for you. If you are enrolling over the phone, we recommend that you schedule an appointment. For those of you that choose to enroll over the phone, you'll do this during your pre-enrollment call. If you choose to enroll online, you're not required to schedule an appointment. If you're enrolling online and have a question, you can pick up the phone at any time during our business hours and call and speak to a benefit advisor. Enrolling online typically takes about 15 minutes to complete an application. Enrolling over the phone may take longer because we're required to read all of the disclaimers to you. So please plan for at least 45 minutes to an hour to complete your applications. This time will vary depending on how many plans that you're enrolling in. Keep in mind, we're required to complete one application at a time, and you'll be asked to restate your personal information for each application. There may be times that we experience higher than normal wait times. We do our best to keep our wait times under 2 minutes. We encourage you to enroll prior to Thanksgiving. If you're enrolling online, once you've made the decision on which plan or plans you want, choose Add to Cart. Your shopping cart and the plan or plans you selected are displayed. Select Start Checkout near the bottom of the page. The Steps to Checkout page appears. There are a few select plans that are not available for online enrollment, such as hospital indemnity plans. If you happen to add one of those plans to the cart, the website will prompt you to call Via Benefits to complete your application. 7 to 10 days after your enrollment, you'll receive a mailing from Via Benefits called the Selection Confirmation Letter. This letter will list the plans in which you've enrolled. This letter cannot be used as proof of payment or proof of insurance. You will receive the full plan details in separate mailings from the insurance company. When you receive this document, please review it to make sure that you understand the information, and if you have any questions, just give us a call. At Via Benefits, we're here to help you throughout the year, not just during open enrollment. We have a help and support page where you can find the answers to most of your questions, which is always available to you 24/7. If you have additional questions about your plan, you can contact Via Benefits during our business hours. And if you need us next year, we're still here to assist you year-round. When you create an online account, you have the convenience to shop for, compare, and enroll in a new plan. It's important to keep your profile up to date. For example, if you started taking a new drug, add it to your profile so when open enrollment comes, you can compare plans based on any new prescriptions that you take. It's time to talk about the Health Reimbursement Account, or HRA. The HRA is a tax-free account established by HPRS to reimburse you for eligible healthcare expenses. As part of its IRS definition, you must pay first and then you'll be reimbursed. Funds will be available starting January 1st, 2022. You may use those funds to reimburse yourself for premiums on your medical, prescription, dental, and vision plans, and for out-of-pocket costs on other eligible expenses. Any unused funds at the end of the year will roll over to the next year. Here's how the reimbursement works in 3 easy steps. HPRS will allocate benefit dollars to each eligible retiree's HRA account. You'll then work through VIA Benefits to enroll in your individual coverage. In Step 1, you make the premium payment to your insurance company. In Step 2, notification comes to us at VIA Benefits that you want to be reimbursed for that payment. That notification can come from you or from the insurance company, depending on which reimbursement option you select. In Step 3, VIA Benefits processes your request, checks to make sure that you have the proper funding amount available in your HRA account, and deposits it directly into your designated bank account. Signing into your VIA Benefits online account is a secure way to request and manage your reimbursements, with options to streamline and automate your reimbursement experience. We recommend that you start by setting up direct deposit. This is the fastest, safest, and most secure way to receive your funds directly to your bank account. Automate your premium reimbursement by turning on automatic premium reimbursement from your online account, if it's available for your plan. Automatic premium reimbursement enables you to be reimbursed for your premium payments without submitting a monthly reimbursement request. VIA Benefits offers this feature for most insurance policies. And go paperless to reduce the amount of paper mail that you receive from us by registering for electronic statement delivery and notifications online. From this same web address, you can also check your current funding balance and see the status of reimbursement requests and related transactions like electronic deposits. Automating processes and using these steps improves security and increases reimbursement speed. Plan on an additional 10 days if you print and mail or fax a reimbursement request. For your added convenience, there's an app that you can download to your smartphone or tablet to manage your reimbursement account. The easy-to-use VIA Benefits Account mobile app is integrated with the website and intuitively designed so you can manage your HRA quickly. With the mobile app, you can check reimbursement status, check available balance, submit new reimbursement requests, or take a picture and attach documents to your reimbursement requests, all from your smartphone or tablet. The mobile app is available for both iOS and Android. Let's drill down into how our automated features, direct deposit, and automatic premium reimbursement work. Automation is the most secure method to be reimbursed. Automatic premium reimbursement is convenient. Once you set it up, the reimbursement is automatically returned to you on a monthly basis. This type of reimbursement can be used for premiums on the plans that you enroll in through VIA Benefits. Over 90% of the plans sold through VIA Benefits support this feature. When you choose automatic reimbursement, each time that you pay your premium to the insurance company, they will send VIA Benefits notification of your payment. We will then send your reimbursement to you through the mail or deposit it directly into your designated account, whichever way you prefer. With automatic reimbursement, you do no paperwork at all. We highly recommend that you receive your reimbursements through direct deposit. It's the fastest, most secure way to be reimbursed. All you need is to provide your bank information for where you want the reimbursement to be sent and use the online form. It's safe, secure, and easy. You should receive your reimbursement within 30 days or less from the time that you made your payment. Most reimbursements should come around the same time each month. If your plan isn't available for automatic premium reimbursement, you can request a reimbursement online or through the mobile app. All necessary instructions on how to use your HRA will be provided in your reimbursement packet, which should arrive around the same time that your new coverage takes effect. This is a very important fact about your HRA. In order to continue to receive funds in your HRA, you need to enroll in a medical plan through VIA Benefits before your enrollment period ends on December 31st, 2021, to have access to your HRA. And you must remain enrolled through VIA Benefits each year to continue to have access to your HRA fund. One last time, let's go through the steps that you need to take. Step 1. Call VIA Benefits for your pre-enrollment call, or go online to complete your information and shop and compare plans. Step 2. Add your doctor, pharmacy, and prescription drug information into your online account, or add it over the phone during your pre-enrollment call. Step 3. Choose which plan type you wish to enroll in, Medicare Advantage Plan or Medigap Supplement Plan, and decide on any additional protection plans. Step 4. Make the decision to enroll online or over the phone. Step 5. Schedule an enrollment appointment during your enrollment window if you plan to enroll online. And last of all, enroll online or over the phone starting October 1st. The last day to enroll is December 30th, since December 31st is a national holiday this year. We recommend that you enroll before Thanksgiving. Thank you for taking the time to view this presentation. We look forward to working with you soon. On behalf of HPRS and VIA Benefits, thanks again for your time, and have a great day.